All right, y'all. So yesterday we started talking about hip bursitis, and I showed you all the different bursas that are in the hip that could be problematic. So you have one that's here in the front of the hip. You have that runs underneath your hip flexor, your iliopsoas muscle. You have one that's out here on this really bony spot. That's your greater trochanter, where you can get trochanteric bursitis. And then you have one right back here, basically like on your butt bone. That you can get pain on with prolonged pressure. Okay, so we talked about what not to do yesterday, which is increasing friction on the bursa. Right? If you have a cut on your arm, you're not going to stick your finger in it and rub it around because that's going to make it more inflamed and hurt, right? So just like that, if you have a bursa that's already inflamed, you don't want to stick a foam roller on it and then piss it off more. But what you do want to do is to take pressure off of the bursa. And there's a few different ways that you can do that yourself. One is to stretch the muscles that are either compressing the bursa or mobilize areas that are not moving that are resulting in increased friction on the bursa. All right, so there's some joint mobilization that's involved in that and some stretching of overlapping or opposing muscle groups. So we're going to go over some of those stretches today. Now, what we're going to talk about tomorrow, the other part of it is strengthening. So a lot of times people get increased friction on the bursa because there's a muscle that stabilizes around that joint or a muscle that's supposed to contract before another muscle group. And if that timing is off or there's muscle weakness, then you start to have excessive motion, and excessive motion can lead to more friction and ends up in bursitis. So if you have a muscle that's not strong, or if you have a muscle that's not working at the right time, then you work on muscle strength and muscle timing. So we're going to go over that tomorrow. Today we're going to talk about mobility because that's going to help to offload pressure off of the bursa so it's less inflamed. Okay, so let's do it. All right, so the first muscle group that we're going to talk about is your hip adductor muscles, these inside thigh muscles. If these muscles are tight, they're thick, they're restricted, they're going to pull your leg across like this. All right, so let's say you're running, you have that open chain swing position where the leg is free. If this is all tight through here and it pulls it this way, that's going to lengthen the TFL and it's going to put length through the ITBand, which runs over this bone right here, the greater trochanter, which we know has a bursa on it. So we want to make sure that we have good flexibility through these adductor muscles. And squatting is the same way. So tight adductors, you go into your squat, they pull your knee in. Again, you have increased tension over the tissues that overlay over this bursa. So we want to open up those adductors so that way it reduces tension on these muscles and ligaments on the outside of the hip that run over the bursa. All right, so one way that you can do this that I really like because it has two benefits to it is lay down on your back, knees apart, and then take a couple of either weighted plates or I'm going to do dumbbells. And you're going to put it, I'm going to set these down. If you lay like this and you feel these kind of cable-y feeling, this is a muscle. A lot of people are like, is that a bone? No, it's not a bone. That's a tendon, right? The tendon kind of feels like a bone because it's like this thick cable-y thing that attaches your muscles to the bone. All right, so in this position, you can take your little weights and you can put them on top of those cables because there is a nerve in your muscles and your tendon that responds to prolonged pressure by causing the tendon and muscle to relax. So if you have a little weight and it's pushing down on that tendon, it can allow those adductor muscles to relax, and then you can go even deeper into your stretch. All right, so I'm just going to let this for a couple minutes and let those adductors really open up and nicely. All right, one thing to watch for is to make sure that this does not cause pain in your lower back. All right, so if it does, you could elevate your feet onto a roller, or you could put it up on a ball, like a medicine ball or something, to flatten your back out. But otherwise, you can do this with a neutral spine. It's good. You also want to make sure that when you have the weights on there, that you're not fighting the weights. So you don't want to be using your own muscles to push back against them. You want to just let them relax. And if it starts to feel like it's too much tension or pressure, Then, slide the weights off, take a little break, move your hips around, butterfly them a little bit, and then go back down into the stretch. But the longer you can hold the stretch, the more effective it is for relaxing the tendons and improving the elasticity of the tendons, okay? All right, so the other one that we're gonna do is going to work on opening up the front of the hip. So that iliopsoas bursa runs underneath the iliopsoas muscle, which is sort of hard to feel, but if you feel that marble in the front of your hip and you feel the bone that attaches to it, this is all the ilium. It's a wing, right? It's a wing bone, and the front of it is where the muscle attaches and comes to the front of the hip. What you feel superficially is the top of your quad tendon, so it's really deep because it attaches to the front of the bone. But if the front of your hip is restricted, so let's say that you don't have good mobility in your hips, you sit at work for long periods of time without getting up, you stand with more of an anterior pelvic tilt, where your low back is rounded out, and you lock your knees out, that habitual posturing actually puts slack on the psoas muscle, and it can allow it to be shortened. But more than that, can even cause the capsule or the hip joint itself, to become less mobile. So this is going to address both of those things, the mobility of the joint and also the pliability of that psoas tendon, right? So that being said, let me kick this out of the way. Not getting those. All right, but I'm gonna roll the front of this mat so it'll protect my knees. I'm gonna get into a lunge position. Now I have a pull-up band, and I just looped it around this box. When I'm in the gym, I loop the pull-up band around the rig. That way, just something so it won't move. Just anchor it, okay? Then I'm gonna take the leg that I'm stretching, and I'm gonna put it through the loop, and I'm gonna get it really up nice and high, kind of like basically underneath your butt cheek. Next, I'm gonna step back so that way I take tension off of I take up the slack of the band, make it nice and taut. Now my knee's gonna stay down to the leg I'm stretching, the other leg's gonna come out in front of me, so I'm in this kneeling position. Now, as soon as I sit upright, you may already feel a stretch here, or you might already feel like a pull in the front of your hip. Now, what you don't wanna do is you don't wanna lunge into it really deep here and open up the front of the hip, because then we're losing that joint mobilization aspect of it. All right, so sit upright first, and before you go anywhere, what I want you to do is I want you to take a look at your hips. This hip, the one that you're stretching, you want this hip to be driving forward. So you might even give a little glute squeeze your butt. Now think of like a rod or an arrow going straight through your femur on the other side, the side that's stabilizing you, and I want you to sneak that hip back. All right, so you want your hips nice and lined up. Then we know that we're not compensating by stretching out the back or overstretching the quad muscle. We want to really focus on the front of the hip, so we need to get it into an extended position. This glute squeeze and driving the opposite hip back helps to put this in an extended position. Now, if you can from there, maintain that, but try to let it go forward, or let the band sort of pull your hip forward, then go for it, as long as you don't start to open up this way, like rotating towards your leg, your knee that's down. You want to keep facing straight forward. All right, go into it a little bit more. You're gonna hold this stretch, and then you can just straighten out the front leg to back off of it a little bit. All right, this is a really good, strong mobilization technique for the hip, and is a really good way to put a little stretch on this psoas muscle in the front of the hip. All right, now let's say that's kind of easy for you. Get into that stretch position. Now I want you to take the hand of the same side that you're stretching. I want you to start to raise it up. And you can even start to let your hip sort of drop towards the side that you're stretching. All right, this is going to start to take up slack from the thoracolumbar fascia, which also attaches to the top of this iliac bone. So we're just elongating all the tissue on that side and really trying to open up the hip and get it into that extended position. Okay, and here for me personally, when I lift my arm up, I really feel it opening here more in the front of the hip even. Okay, notice I'm not losing that forward facing position of my pelvis. All right, so what that does is it helps with the joint mobility of the hip joint itself. It's allowing the basically the ball part to sort of roll and translate forward. And then you also are stretching out that hip flexor tendon, making it more pliable because it runs over the top of the bursa, and we want it to not be compressed down on the bursa. Okay. All right, next we're going to do one that is, again, a hip mobilization technique, but this one's going to draw, I like to use like hand signals, but so if this is like your wing bone here, and there's like a little cup on it where the leg bone attaches to, so here's your head of your femur, right? What this one does is gonna just sort of decompress the joint space a little bit, so that helps with all movements of the joint. And then we're going to stretch out the glute muscles, because if the glutes are tight and adhesed, you're not going to be, that joint's not going to be able to translate backwards fully, like if you're going into a flex position, like when you're going into your squat, right? If you're going into a squat where your pelvis is dropping below your knees, then that hip needs to be able to rotate on the inside, right? It has to be able to externally rotate to keep your knees out, and then it has to be able to translate back. But if the glutes are really adhesed, it's going to stop that posterior motion in the hip capsule. So this helps with that. Okay, so I'm going to keep my band wrapped around my block here. Now I'm going to put the leg I'm working on through the band. I'm going to get it up nice and as high as I can here on the inside of my hip. Then I'm going to lay down on my back, and just like you're doing a glute stretch, make sure that you sneak away from where the anchor is, so that way you're getting a good pull. All right, so as soon as you push yourself away from where it's anchored at, you're gonna feel the band pulling your hip out to the side. And for a lot of people, get really good relief in their hip and their lower back with just that. All right, but from there, if you want to add the glute stretch to it, you're gonna take your knee and you're gonna pull it kind of across your body and up a little bit towards the opposite shoulder, and you're just gonna hold it right there. Some people like to sort of go in and out like this. Some people like to do like a little circle with their knee, because it just feels really good on the hip joint itself and helps it to open up. Okay, but the more you pull towards the opposite shoulder, the more you're gonna feel that stretch. Well, I'll show you on the opposite leg, but the more you pull your leg across your body, the more you're going to be stretching down here in the glutes. All right, because the glutes are so broad and flat and layered, they tend to get adhesive tissue or not be able to move and slide and glide properly on top of each other, or they can just get tight after you've had a workout doing lots of squats and stuff like that, and it can feel good to stretch them out, make them more pliable. So that's a really good one that you can use to mobilize a joint and work on making your glutes more pliable. All right, then the last one that we're gonna do is sort of like a different take on a familiar stretch that people do, and this is for your piriformis muscle. So your piriformis muscle, it runs deep to your glutes, and it does a couple different things. So when it's in a flex position like this, so let's say your knee's in front of your hip, it internally rotates your hip like this. So a lot of times when we stretch it, you'll see it like this, where it's pulled up and then externally rotated like that to stretch it. All right, when it's in an extended position, or your knee is back behind you, it actually does the opposite. It externally rotates. So we don't usually stretch it so much that way, but we're stretching it forward. So what we're going to do is, instead of doing it here on the mat, we're going to do it up on a block, all right? Because I really want to focus on getting that joint mobility, that hip being able to push down and back into the socket per se, while you're doing the stretch, so that you get dual benefit out of it. All right, so you're going to take your foot up onto the block and get into like this lunge position. Now for some people, just drawing the knee out to the side at this point may be a good enough stretch for you. And honestly, for me, I already feel that in my hip. All right, but for the more flexible people, let's see if I can do this. You want to bring your shin bone down to the block and try to get it as parallel with the block as you can. And then you want to sink your hips down. All right, and you should really feel that back here where that piriformis muscle runs. Okay, now one good thing about having your foot down is you could sort of butterfly it, so you could move your knee up and down and really just work on that dynamic mobility, which is what I really like to do. But if your hip's really hurting, that might bother you, the static position might feel better. So you have a stretch for your hip adductor muscles. Those are ones on the inside of the hip. If they're nice and loose, it's going to take tension off the outside of the hips. You have one to open up the front of the hip, where that iliopsoas bursa runs underneath the iliopsoas tendon. So we want that tendon to be pliable. We want the joint to be able to move, so it'll take pressure off of that bursa. And then we also have that pigeon pose, where that'll loosen up the piriformis muscle, which runs in the back of the hip, which again, if that's tight and that's compromised, then you could get pinching in the bursa in the front of the hip. And we also have that lateral glide that we did with the band that improves all mobility at the level of the hip and is really good for mobilizing those glute muscles, which will also affect that ischial tuberosity bursa that you have back there. And it also, because your glutes wrap around and they have fascial attachments here towards the TFL, that muscle right here, and the ITBand, you want to make sure that these are nice and loose too, so we have that stretch. All right, so there's lots of other stretches that you can do, but I feel like these really hone in on really specifically opening up and mobilizing areas around these bursas. But try these out, see how they feel. If you have more pain with some than others, don't push into that. You want to push into restriction, but you never want to push into pain. Use the ones that are not painful.